We're recording. Okay. So this is my microbiology semester project. Well, you can notice my collar shirt. This is how professionally I dressed up for this. The person steering my camera is Terry. She is like if my mother was in nursing school. That is also accurate because they both have that reddish, blondish hair color. Although my mother's is significantly more gray. No offense, mom. Okay, so I have my script here, I have rubrics here. I'll try and cite my sources as I go along. So what I'm going to show you today is the primary IV bag setup. Now the principles in this video are going to remain similar across secondary bag setup, particularly some of the hand hygiene. You have to wash your hands, but it would just feature another bag here with more tubing set up. Normally, it starts way up here with a bag. It should usually be hanging about 3-ish feet up from the patient so gravity can take it down. Then we have our tubing here. And here, this blue section, I don't know if you can see this. Okay, we should be good to see that. It has tubing connectors where you could insert and where you would hang or connect the tubing for the secondary bag, which is like normally would be an antibiotic with the fluids. Uh, you have a clamp. This controls how much. Can you see that in the video? I don't know. But the higher up it is, the faster it will go. Hold on. And then you would unclamp this. And you would unclamp this clamp and the roller. I have to give the bag a little shake, but normally it should start going. Yeah. Okay. Gotta make sure this is unclamped. So now that everything's unclamped, here's another little tubing connector. It flows down into here and through the needle and catheter and into the body. Woo-hoo. Look at all that. So is the feature of our normal setup. This is not featured in the video. This is just something the nursing program has, but it also would go into the arm for like blood transfusions. Cable. Okay. So there's that. Now, the first major parts of the video, or of the rubric I have here, I have highlighted some important parts that maintain to the sterility and making sure no bacteria get in here and then get into the arm of the person. So those first parts are, of course, hand hygiene when you walk into the room. There are also sections, even before you spike or put any needles. Yes, we have hand sanitizer here. That is one thing you could use. You could use the sink over there. And before you even start any needles on the patient, or you do hand hygiene or do anything related to that, hand hygiene, hand sanitizer, washing your hands, good stuff like that. Now, and when you gather your supplies, you also inspect the bag for any discoloration or yellowness. And if there were that or tears, that could be indicative of bacteria or any other issue with the bag. Specifically focusing on bacteria, once they're in the bag, they can flow, or once they get into the tubing or any other section. Spiking the bag, and another part is spiking the bag, which you can see here. There's this part where there was a seal, and this sharper part punctures the bag to allow it to get into this chamber and then be flowed in through the tubing. Now, if it says to maintain sterility, so when you're doing this, you don't want to have this, and you have to be aware of your environment, which we'll focus on in a little bit, being more aware, so that nothing gets into the bag, or as little as possible. Then you have your tubing. Same thing, you just check for hairs, and then you have where it inserts in to the patient, or where the needle is. I've also covered off where things can go wrong, but another one, normally you'd flush this, well, let's see if you can do this, into like a trash can. Not this much, obviously, but you'd flush it to get air bubbles out, because we don't want those going into the patient. Okay. Saw that for a little bit. You would do this over a trash can or a sink, but since this is a part that goes in, that connects to the patient, if I were to be carelessly fiddling with the bag and it lands on the floor and I don't notice that, then this has become contaminated. Or if I don't have as good a hold on this and it goes in, you can manipulate it back up more. I'll just show you right here. If this goes in to the sink or the trash can, then it has become contaminated with bacteria, and then it flows into the body. So don't be swinging it around or don't put it in any trash cans. So just generally be aware of your surroundings. This includes where you place it. So if a table's dirty and you know it's dirty, don't have a paper towel or something you can put it on. That's what we have done in class before, or just generally a sanitized surface to put it on. Okay. So, there are cases of this happening. So, this is a problem. Here in this syringe, I have some dyed fluid. Show you that. So, this is going to mimic the bacteria that would be in a bag, and I'll show you it flowing to the arm. So, this is safe for the arm, so you don't have to worry about that. I'm just going to inject it. Hold on. We should be punk. Let's see. Representing our bacteria. Now, some of you are probably cringing at how I'm using the needle, but good thing this has not been inside anybody. Okay, here we are. You can see normally, so since this is mimicking our bacteria, you wouldn't see the bacteria. But there was a case of this. In New Zealand, in 2020, a 20-year-old woman had undergone heart surgery, and I don't know what medication they gave her specifically, but they needed to have an IV. As you are frequently when in a hospital, antibiotics, pain medications, or just fluids for rehydration. So what happened was, somehow bacteria got into her line and into her IV site. So we'll mimic that now. Hopefully that starts flowing. I might encourage this by squeezing the bag to make it go a little faster. So I might have to. Hopefully this works. Oh, okay. It's a little full, but you can see how it's now in the chamber and how it would flow down to into the patient. See if we can get it going. Oh, it's flowing. Oh, it goes a little faster. Mm, this should be going now. Okay. You can see it flowing through. You should be able to see it flowing through now. Oh, it's too. Okay. I might. It's flowing now. Okay. I got this flowing. Hopefully be flowing. Yes, it is. Okay. So, when this flows down, it flows down and went into the IV site on this lady's arm. Now, when the IV sites are useful in a case like hers, but the site became infected. So here around where the IV site for this woman, you could see pus. I believe there was redness and, yes, there was, and phlebitis. So phlebitis think of it as like is a vein that turns red, and you would be able to see it. So there is an arm that would show this on the Southwest has one, right? Yes. That would show the redness and what it would look like as part of the simulation. However, we were not able to get that arm for this, but you'd see it where the vein goes, or the IV goes into the vein, and it'd be red. Yes, it is. Okay. Anyway, it would be red, tenderness, pain with this, but apparently it was sitting around for a long enough time without a visual assessment, and when the nurse found it, the nurse took a swab to have the labs culture and culture it, and I imagine there would be sensitivity tests for antibiotics, but this must not have happened in enough time, and she was discharged without having anything been done. And then she developed septicemia and died as from cardiovascular shock related to that. I believe is what it's called. And this happened in New Zealand, so they might have a different little setup over there compared to how or when they assess it. But normally, when a nurse assesses this, they would look at the site for any signs of this, or they would change the site if they did notice that, and notify the provider about infection. Okay. So, that story. Now, the story does reveal valuable information. Center myself. So, was the nurse correct to swab the site? Yes. That would give you information related to antibiotic resistance, or which ones would be most effective for treating this patient. The lack of reporting or even noticing, I have in my notes here that her general practitioner and the doctor was not notified of these complications after having heart surgery, and there would be rounds, so I don't know how this exactly was not caught. But yes, IV or antibiotics would be used in cases like this, or just more generally, if you have an infection related to sites. They would have also removed the IV, stopped the infusion, and went, if they needed to, they would have went to a different site, a different vein, probably in a different arm. Or that's what we would do in normal clinical practice. So, what can you do as a nurse, or if you had to give someone an IV, or hang their bags, what could you do to make sure that incidents like this didn't happen? Well, you have hand sanitizer right here, and you're not going to be able to use hand sanitizer with bacterial infections, and it's dependent on the patient's precautions, but like C. diff is not going to kill the bacterial spores, but so hand hygiene. Anyway, hand hygiene, before I go off on a tangent, hand hygiene is probably the most important step, so you can use it throughout the process as needed. So when you enter the room, I'm using the script here, the rubric that the nursing instructors use. You perform hand hygiene like 3 separate times throughout the skill to adequately maintain your sterility. Personal protective equipment. You're also wearing gloves throughout this procedure. But I didn't do that for this video. But you would normally, with a real patient and not a fake arm, you would wear gloves throughout this. You'd also perform your assessments. You perform your assessments properly, inspect the bag sterilely, and maintain a clean environment. Also, alcohol swabs before you flush the IV port, which is something I forgot to mention until now. It's just a saline injection just to make sure the IV's good to use. But you'd normally swab this site here. Right here. Like this. You'd swab it and inject it into here to push. This would be for IV push medications or for normal saline just to make sure it's paid. Okay. That clamped. But we can flush this out and show you, see if we can get more of a. Okay. Well, this might take a while.
Well, I can actually see where your roller is from back here. I can see the tinge of red.
Okay, good.
So I don't know if your video is gonna. Yeah.
Can you see it on the?
I can see it from
Okay.
back here that you've actually
Got a tinge of red. Okay, that's
you got
great.
a tinge.
That's great. But also, that's really good that we got that tinge. Okay, so we do have a tinge. So I'm gonna just hook that up more. Hook that back up normally this clamp so it doesn't get in the arm. But we do have a tinge. I don't think we have a tinge here. It's still leaving, so that's good. The arm is safe. But we would use alcohol swabs. Also, we'd use them up here if we were connecting a secondary site. So we'd use plenty of alcohol swabs as well to help make sure nothing gets in there while we're fiddling around giving our IV push medications or our saline flush. Okay, again, being aware of your environment. Don't stick it in a trash bag or in a sink or on the floor like I was. Don't do anything don't put it in any bodily parts. Don't put it in your mouth. Don't take needles off with your mouth, please. Don't. Also, perform your assessments, because this probably is going to happen statistically, it's going to happen at some point probably, where there is somehow bacteria going to get in your line. And you, the nurse, are responsible as part of your healthcare team to make sure stuff like this doesn't happen. So please perform your assessments like you normally would. Don't go swinging this around. No. It's not a lasso, so don't be swinging it around. You're going to get everything all over. Probably getting a few drops all over, but don't do that. So please, just be responsible. And if you're not responsible, I will be very sad and mad at you. And I don't know, but don't let me be sad at you, or mad at you. I don't want to be sad or mad that you accidentally infected a patient with something. So let's not do that. So please keep your patients safe. And that should be the end. This should be all relevant information for you. Again, no hurting patients. That's a no-no. I'm going to finger wag you. Okay. So that should be it. Thanks for watching.